you discuss just how the Sim Lab is incorporated into the curriculum?
We are sitting in our what we call our clinical building or the simulation lab. And we have we're sitting behind one, but we have actually 4 simulation bays. So we have 4, you see, that's an Apollo 3G mannequin, and they're pretty powerful high fidelity simulators. We've got 4 of them, which we're really excited to have. So we can program these simulators to do all sorts of things. So really we can program them. They can urinate, they can sneeze, they can cough, they can talk, they can, facial expression, pupil dilation. We can do all sorts of things depending on the type of case that we want to run for the students. And so what's awesome is even from first semester, you're in 2 courses, Foundations of Medicine and then Patient-Centered Care. So Foundations of Medicine is what we were talking about earlier when you're studying and we go into class, we do cases and questions and things like this. The Patient-Centered Care component teaches students how to take a history and physical, do that exam, and run in a simulated environment, similar to like aviation. If you're going to go out on a plane, you can use a flight simulator. Well, here's our patient simulators. So even in first semester, maybe, I don't remember what week it is, but maybe a month in, you might be in your first simulation. And by the time students are in 5th semester, they get really used to this. So it's all set up like emergency department room. So there's, bells going off and songs and everything, and there's a crash cart. And so the students can go in and here's the patient, and they have to inspect and monitor, and then they can utilize the crash cart and everything based on what they think the diagnosis is. And then we can change the sort of the response of the simulated patient to whatever the students are doing. So this is really fantastic because you can get practice and you get more comfortable as you go through the semesters. In the semesters, we put more simulations in and they become more complex. So it's really valuable, and I think it's very progressive and innovative. Not all schools have this, especially 4 bays of simulators. We also have other task trainers for heart sounds, bowel sounds, intubation task trainers. And we have 6 clinical exam rooms where the students will work with. We actually hire in standardized patients. And what that means is patient actors. So they're trained up on a case and they're going to act out an ailment or disease state. And then the students have the opportunity to inspect and, exam and write it up. And what's awesome is everything in here is recorded. So the students, they can go to the debrief and go through the recording and have the discussions with the faculty on what could have gone better, where can we improve, or how did you feel about it? And so it's a really wonderful learning experience, and it's where I think the excitement is at, because this is what you've come here to be a doctor, and this is the first real sort of simulated environment where you feel that sort of rush and energy. So it's really great.